My name is Alexander, and I work in Nürnberg. I live in Regensburg, and I'm really pleased to be here and to give this presentation about digital patient care of tomorrow. But before we start, at first, besides the hype of AI and blockchain, let's talk about the status quo and the potentials of digital patient care. And let's start with our everyday life, where we not necessarily are patient, just at home. Yeah, we maybe have voice assistants, which turn the lights on and off and control other devices on command, which is nice for us. But especially if for immobile or disabled people, this can be very helpful. And of course, we have smartphones, smartwatches, and smart rings which collect our health data, and also things like fall detection, emergency data, or an ECG with a smartwatch is the new normal. So. And the interesting thing is the data is becoming more and more precise. In my family, we had a case example, it's a true story, was a heart rate monitoring with the smartwatch detects an arrhythmia. And it gave the possibility of treatment for the doctor before it gets worse. So if you look to the potentials, I think the technology will continue to develop and we will see much more of this, especially in predictive analytics and in prevention. But I also think it would be good to have a transmission of this data to doctors or to the electronic health record. So let's look to the next step, the preclinical time for ambulance service, rescue service. What we have is simple NIDA pads, which are recording patient data and also transmission it. And of course, we have the telematic infrastructure with emergency data, with electronic medication plan, and patient recording. So if you look now to the potentials, we have to say, yes, NIDA works and is being expanded, but not at all areas in Germany. So also the 5G telemedicine in ambulance service would be nice. If you go to the DMEA, there is a 5G ambulance car, which is really exciting. And I think the TI for the development is necessary. Some of the information is not available or not accessible in the ambulance service. And of course, a readout of smart devices would be good. So let's look to the next step in this patient journey, the clinical care in hospitals. And what we have is an increasing digitalization through the Hospital Future Act from the emergency room to IT security, with clinical decision support, digital drug therapy, safety tests, and so on. And also we have AI functions like early sepsis detection, AI-supported documentation, and AI analysis of ECGs or X-rays. So yes, we have these things, and these are really good solutions, but they are not widely used. If you go to a small or a middle hospital, maybe you will find almost nothing of these things. And I think we need the external exchange of data could be much better. So let's look to the next step after hospital the time. We have again the telematic infrastructure to connect the various stakeholders. Also, we have the cool things like blood sugar measurement via skin sensors, or telemetric monitoring of pacemakers. So we have many good solutions. But also, I think we have to mind the gap. I can see a user overload in digitalization. If you look to the potentials, again, I think that TI for the development is necessary. Also, telemedicine as a standard, and digital support of intersectoral processes. And also, I think there's a need to further develop the digital skills of users. But all in all, I think we are on the right way. We have the TI, we have the Hospital Future Act, and the other things. And these things are driving digitalization forward. And the result is, hopefully, structured data. And this is a base for a new level of data-driven healthcare. And there are much more digital things like European Health Data Space, Research Data Center, and Center for Synthetic Genomics, and other different things. So the digitalization of the German healthcare world happens right now. And this digital revolution promises real value for the healthcare system, not just digital happiness. With a change to proactive information diagnostics and also improving for research. So IT is becoming more and more an essential technology. To look to the potentials, I think especially we need education programs to handle the new technology stack. And also, of course, IT security and IT resilience. So let's look to the next big topic, AI with a small deep dive. Almost every day we get news about AI. And Gartner says, Gen AI is at the peak of inflected expectations in 2023. And, Trommelwirbel, also in 2024. So, AI is between hype and innovation, but also, and I think you will agree, AI is here to stay. So let's take a closer look. What we see at the moment is the battle of AI titans, ChatGPT, Copilot, Gemini. Also Made Gemini is an interesting concept. And there's much more, even AI search engines you can find on the web. So, but when we look closely at AI, it's important to remind that the difference between machine learning models and explainable AI. So we have to mind the gap with machine learning. The results are not transparent, it's a black box. And partly we have incorrect results and AI hallucinations. So we have to remind that it's still an early stage in the development of AI. Especially in the medical context, we need AI that can explain the results. When an AI analyzes an X-ray, I would prefer the result is based on more than just a comparison with other X-rays. It would be good if the result is based on valid and measured data. So, but I suspect that it won't be long before medical AI applications will be able to validate findings much better than they can today. And looking back to the patient journey from earlier, I think AI will have a big impact on all of these areas in the future. Especially reduction of errors and also prevention. So let's look to the next big topic, blockchain in healthcare. Before I start with this, who in this room has cryptocurrencies? Okay, yeah, I was thinking it's a little bit more. Okay, here you can see something how blockchain works, but please allow me to skip this slide. You can read it later if it is interesting for you. It's more important to look to the characteristic of blockchains. And that's unchangeability, transparency, security, and it's a base form or platform for smart contracts. And smart contracts are just program code automation based on this manipulation-proof blockchain. So here you can see something about blockchain architecture. And please allow me again to skip this. You can read it later. Because I think the important question is, why could we need an unchangeable, digitalized database that can be viewed by several actors in the healthcare system? And the answer is, wherever important proofs are required, any implants, transplants, transfusion, tracking of medicine. So, in some countries, there are already established blockchain solutions in the healthcare sector. For example, America, not just the US, North America, 70% of drugs, of medicine is tracked by a blockchain. You can say this charge number, charging number, I don't know the name, you know what I mean, is in this country, in this city, in this drugstore. That's really cool, I think. But honestly, the implementation of a blockchain solution within Germany or Europe is still uncertain. So, one of my last things, what's next? I think robotics will be one of the next things. Actually, robotics is still here, but not with a big impact into widely use. Then I think digital twins will come more, also for medical devices, and of course, personalized medicine. Summary, there's still a lot to be done for all of us. And I found something interesting. The future we want must be created, otherwise we will get one we don't want. So in the context of digital patient care of tomorrow, I think it's important to make digitalization, like in your hub, sustainable and practical for all of us. So, at last, some personal science fiction recommendation with an interesting ideas of the future. Of course, Harari is important, but also I can highly recommend Quality Land. It's very good and very, very funny. Even more future trends you can find at the Future Institute. And now I'm finished. It was digital patient care, AI and blockchain in fast track. I hope it was interesting for you. And any questions you may have, you can discuss later.